Patellofemoral pain syndrome refers to pain behind the patella, also known as the kneecap. It may occur secondary to trauma, dislocation, or malalignment of the lower extremity. It often occurs from overuse, but may have no specific identifiable cause. A number of stretches and exercises may help to improve patellar motion and tracking within the groove in the front of the knee, thus improving stability and decreasing the pain in the front of the knee. There are a number of ways of stretching your hamstrings. One involves the use of a chair in front of you or a stool and placing the heel of the leg to be stretched up on the chair. Then using both arms, reach in front of you and try and touch your ankle or toes. This should be done with the back as straight as possible to avoid bending through the shoulders and upper back so that the hamstrings in the back of the leg are being stretched. This should be held for 30 seconds and be performed 3 times. Patellar mobility can be improved through passive stretching. Using both hands and with your leg in front of you while relaxing your muscles, feel the top part of your patella and gently push down. This should be held for 10 seconds before it's released. This should be followed by the opposite motion, holding the bottom part of the patella and pulling upwards. Also hold this for 10 seconds. The third stretch involves pushing the kneecap inwards toward the other leg. Hold this for 10 seconds and continue to repeat these 3 stretches for a period of 5 minutes. The quadriceps stretch should be performed against a wall or a table for balance. In order to stretch the quadriceps in the front of the thigh, the knee is flexed, using the opposite hand to grip the ankle or foot. It is held in place, feeling the stretch in the front of the thigh. This should be held for 30 seconds and should be performed 3 times. The hip flexor is the muscle in the front of the hip that helps to pull the thigh in front of you. To stretch it, assume this position with the side to be stretched kneeled on the ground and the other leg out in front of you. While you're in this position, slowly lean backwards with your torso and you will feel these muscles in the front of the hip being placed on stretch. Hold this stretch for 30 seconds and this should be done 3 times. The isometric quadriceps strengthening exercise is performed lying down. With the leg to be strengthened, straighten the knee and lift the heel away from the ground. This should be held up in the air for 5 seconds and then relaxed. This should be repeated a total of 10 times and then do a total of 3 sets each.